BLS. So your mannequins have just now turned into Johnny.
You've learned BLS for adults, but what if the victim had been a child? There are important differences between BLS for children and BLS for adults. Under the American Heart Association BLS guidelines, anyone from the age of 1 to puberty is considered a child. For these BLS guidelines, puberty is defined as chest or underarm hair on males and any breast development on females. When performing compressions on a child...
So what the heck does that mean? Is there an age? No. Are we looking for an age?
No.
Okay, so we got Johnny on the ground, and I'm like, yo, Johnny, can you talk for me? I need to know if your voice squeaks. He's going through puberty, right? Squeaky voice thing going on? No? Okay. So you have to look for something. What are you looking for? Underarm hair. I know that's kind of weird, but it's like, dude, Johnny got, okay. So we're gonna go with an adult because he's got underarm hair. Doesn't have underarm hair, we're going with Johnny. If they're right there, if you don't know, if they're like right there between like the 13, 14, and you're like, I don't know. If they're in high school, what do you think? You're gonna treat them as an adult or a child?
Adult.
An adult, right? They're big enough. You're gonna have to just do your best. That's it, plain and simple. If you think they're an adult, if you think they're above puberty, treat them as an adult. If you think they're a child, treat them as a child. It's plain and simple. Are we good with that?
Yeah.
But the American Heart Association will give you a defined thing. Okay? It's underarm hair for a male and breast development on a female. They have those things, they're an adult. Good? Good. Okay. Now when we do deal with Johnny, think of like a 4-year-old. Think of a 4-year-old. If I were to push down really hard on a 4-year-old with 2 hands, you're going to crush them. So if they're small, if they're a small person, you're going to use 1 hand so you don't crush them. But for some of you, maybe you're just not getting enough in there with that 1 hand. You might have to use 2. Maybe they're 11 years old and they're a big 11-year-old. You know, man, you're big for 11. You know, you might have to use 2 hands to get those about 2 inches. Okay, so you got to use your best judgment. That's what makes you the clinician. You are now a clinician, and you have to do your best, okay, with what you have in front of you. It's already a bad day that someone had to collapse in front of you. It became a worse day when you assessed them and they didn't have a pulse. So now you are having the worst day of your life because it's a great day because you get to use a tool that you didn't think you were going to get to use, and then you have a bad thing because someone's dead in front of you. Okay? And when it comes to a child, it makes everything so much worse. Okay? I'm telling you right now, if you think an adult going down is hard, try having a child go down in front of you. Okay? That is hard. And I'm telling you that from experience. If one of you were hurt in front of me, you don't think I would have a hard time with that? Yeah, I would. If it was an 88-year-old person that was having a hard day and dying, I'd be like, I'm doing my best. Oh well. You know? But you guys, you're important. Okay? Every life is important. But you are way more important. Because you've got a long life to live. Okay?
Child, use 1 or 2 hands, whichever allows you to provide deep, effective compressions. Compress to a depth of at least 1/3 the depth of the chest, about 2 inches or 5 centimeters, allowing the chest to recoil completely.
Everybody good with that?
If you are unable to compress to the correct depth with 1 hand, either due to fatigue or lack of upper body strength, use 2 hands to provide ongoing high-quality compressions. For a single rescuer for victims of all ages, use a compression to ventilation ratio of 30 compressions to 2 breaths. If you are in a 2-rescuer team for children, the ratio should be 15 compressions to 2 breaths.
Whoa, 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 whoa! Big change here. Big change here. When you have 2 rescuers with Johnny and infant, your ratio changes from 30 to 2 to 15 to 2. But when you're by yourself, what is the ratio? 30 to 2. Everybody get that? Okay, so if you're with an adult by yourself, what's the ratio? 30 to 2. What's your ratio for adult with 2 rescuers? 30 to 2. What is your ratio for Johnny by yourself? 30 to 2. What is it for Johnny with 2 rescuers? There we go with that. Okay, it's a huge change.
Delivery of breaths to children requires less volume and force, but you still need to use enough air to see the chest rise. There are some differences in when to activate the emergency response system. If you did not witness the arrest and are alone, you should perform 5 cycles of CPR before you leave the child to activate the emergency response system.
This is one thing that I find everybody I teach misses this type of question. A single rescuer, okay, that would be you, by yourself. That means if we're in this room together and there's nobody else but you and your victim, you are going to perform 5 cycles, which is approximately 2 minutes of CPR before you activate 911. However, wouldn't it make way more sense if Thomas and I were in the room, we came across Johnny, I start compressions, and he goes to get 911? That makes sense, right? So this only applies when you are by yourself. Everybody good with that? So when you're by yourself with Johnny or infant, both infant and child, we call them aliens because they're children. Okay? We treat them differently. So with child or infant, if you are by yourself, you're going to give 2 minutes of care before you dial 911. Why do you think that is?
You don't know how long they've been there.
Huh?
You don't know how long they've been there.
True, you may or may not know how long they've been down. What's another reason? Huh? It is a full cycle. You are correct on that. But why do we do this? Why do we give care to a child for 2 minutes before we even call 911?
Because you need to get the heart pumping.
Huh?
Because you need to get the heart pumping before you call 911.
You may, but I guess what I'm trying to get at is why do children usually go down? Is it because of a heart condition? No, it's because of, someone said it, close. Some type of respiratory problem, like choking. Some type of respiratory problem. Could be from birth, could be because they put something in their mouth. Any type of respiratory problem. Because adults earn their heart attack. We earn it. We go to McDonald's, we go to Burger King, we earn those, those arteries all messed up with all this cool fattiness in those arteries. So we earn that heart attack. We earn it over time. Children, they haven't been on this earth long enough. Well, hopefully they don't go to McDonald's every day. But if they did, they might have a heart attack. We might see that. The youngest I've seen someone actually have a heart attack was 22 years old. So it can happen nowadays. It used to be like, that never happened. Like, it wasn't even our scope of practice. But a 22-year-old came across the desk, a 22-year-old with a heart attack, meaning a clogged artery. So it can't happen nowadays. It's getting worse.
It was a clogged artery?
Clogged. It was a full STEMI. We call this STEMI.
Was he, these kids can appreciate this humor. Was he ginormous?
He was obese, but he wasn't like ginormous. He just ate horrible since birth. His mom and dad took him to McDonald's every day. He had McDonald's every day. So,
Wow.
yeah. So it goes to show you, don't have a cheeseburger every day of your life. Okay? Does anybody know the difference between a heart attack and a respiratory arrest?
Oh my God! All of you guys dance should be in the air right now.
Huh? What's the difference? What? What's the difference between a heart attack and a respiratory arrest?
Arrest when it's completely stopped.
Okay, huh?
Isn't arrest when it completely stopped?
Well, yeah, okay. Yeah, I'll give it to you. Their heart's not beating, right? Huh?
Isn't respiratory arrest when it
Well, I'm not asking what respiratory arrest is. I'm asking what a heart attack is and cardiac arrest.
Cardiac.
Cardiac. Cardiac arrest is when the heart stops. I'll give you that. I'll give you that. The heart has stopped. Or it's in one of those rhythms. Okay? That means that the heart is not beating. When someone is having a heart attack, can they be conscious? Yes. So why are they having a heart attack? Their artery is clogged. Yes. Okay? That means that their heart is dying. There's active death happening to the heart right now. Yes, a myocardial infarction. It sounds really cool. They're having an MI. Okay? So know the difference between what a heart attack is and a cardiac arrest. I won't understand how many people come up to me. He's like, well, he's having a heart attack. Well, actually, he's in cardiac arrest. Well, that's the same thing. No, it's not. Okay? And they have caused the cardiac arrest. The MI may have caused the cardiac arrest, but they're not having a heart attack necessarily. Okay, everybody good with this? I'm going to change it up just a little bit here.
If the arrest is sudden and witnessed, leave the child, activate the emergency response system, get the AED or defibrillator, then return to the child.
Okay, so I just told you that if you came up to Johnny, you didn't know what's happening, you have to do 5 cycles of CPR or care, then call 911. However, if you witness the arrest, you're going to take out that AED out of your back pocket and put it on Johnny right now and defibrillate him. Why? Why do I bring this up? Why is this so important to me? Well, time is money. Time is money. So if you see that Johnny, let's say that Johnny was playing baseball, okay? And he was pitching. And Thomas over there, he's a really good batter. And I take that pitch, throw it at Thomas, and he hits a line drive to my chest. I fall down immediately. I am motionless on the pitcher's mound. There's a sigh across the audience. No one goes to the pitcher's mound except for the coach. The coach gets there. He's not moving. He pushes Johnny around. He's still not moving. Luckily, the coach knows what to do. He checks for a pulse right away. Johnny has no pulse. What do you do immediately?
You call them.
You better get someone in the stands to call 911. What if you were alone? What if it was just you and your son, or you and your nephew, and you're out there just playing around, and you happen to be the bigger batter, and you're like, I got this, Johnny, I'll show you what's up. Boom! And you hit a line drive to Johnny, and you knock Johnny over, and there's no one else around. You go up to Johnny, you check for his pulse, he has no pulse. What do you do then? Do you do your 5 cycles, or do you get up and call 911? You witnessed it. See where I'm getting at? You witnessed the arrest. So you're going to call 911 immediately. Grab an AED, come back to Johnny. Because you know it was from cardiac. It's cardiac related because you witnessed it. Does that make sense? Does anybody have any questions? And it's okay to have a question on this. Yes?
What if we don't have an AED?
The only way to convert that rhythm is with that AED. So you're hoping that ambulance or that fire truck is right around the corner. That's the only way to fix that rhythm.
Even though you witness it, why wouldn't you do cycle switch and then call?
Because we know it's cardiac. The unwitnessed part, we don't know what happened. We're hoping it's respiratory. And we're usually pretty good at fixing that respiratory problem in 2 minutes. So you may be able to fix that problem in 2 minutes before you call the ambulance. Does that make sense? But you saw that cardiac event. It's usually done because of some type of trauma. Maybe they fell. Maybe they fell right on their chest. And now they're all of a sudden motionless. And they're not moving. And you go up to them, they don't have a pulse. That's what caused the arrest, is they fell. Okay? You saw them playing baseball. Someone hit a line drive and hit their chest. Well, if there's a lot of people around, you can go get someone to call 911. But if you're alone, you need to not even take care of them. Go grab an AED and try to fix them later. Because you know what happened. But kids, they fool us. Because kids are so good at fooling us. If this is an adult's lifeline, we kind of do this. A child, their lifeline goes like this. They compensate super well. Meaning, like an adult, they look crap. They look crappy all the time. When they're dying. They get pale, they get cool, they get diaphoretic. They have all these different vital signs to tell us, well, yeah, they're declining. They're what we call circling the drain. Okay? An adult, we can see that clearly. But with a child, we're like, okay, Johnny, you're looking good. You're looking, whoa, Johnny, oh gosh. Oh man, Johnny. And we're behind the 8 ball. And when Johnny gets to that point, there's nothing we can do to get him back. We have lost him. So we have to stay above the 8 ball and make sure we're doing the best thing we can. Okay? So that way, when we just arrive and we turn a corner, we're like, oh my gosh, Johnny! Okay, I'm going to take care of you for 2 minutes, then call 911. Are we good with that? Did I kill it? Okay, cool. Killed the dead horse.
As you can see, there aren't a lot of differences between adult and child CPR, but they are important ones. Right now, we're going to pause the video to allow you to get into position to practice child compressions. Remember, when performing compressions on a child, use 1 or 2 hands, whichever allows you to provide deep, effective compressions.
Okay, get into your groups. The first person at the mannequin, the second person disperse. Go to the outside. Remember, I want you to use 1 hand. Remember, we're going about 2 inches, about 2 inches, about 2 inches. We are by ourselves, so we're doing 30 to 2. 30 to 2 by ourselves, 30 to 2 by ourselves. When you get your partner there, it's going to change to 15 to 2. So if you're rescuer number 2, you should be on the outside.
Now that you're in position, let's begin. Follow along with the video footage as you practice, and switch students on the mannequins when the video instructs you to. Are you ready? Here we go.
One, two, three, four.
Get it down there, deeper.
8,
Come on.
9, 10,
Get it down in there.
13, 14, 15, 16, 17, 18, 19, 20.
Count out loud, just like last time. Count out loud.
7, 8, 9, 30.
Excellent. Give 2 breaths.
1, 2,
Get back to the
3,
compressions.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16.
Get it all the way down in there. Hit the back of that mannequin.
14, 5, 6, 7, 8, 9, 30.
Partners, are you watching your partner?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now we're going to pause the video to allow you to ask questions and prepare for the next section of the course, Infant BLS. The two. Now. Oh. Okay, now that you're in position, let's. You should now be in position to practice the full sequence of 2 rescuer BLF. Now we're going to pause the video. Now that you're in position, let's begin. Follow along with the video footage as you practice, and switch students on the mannequins when the video instructs you to. Are you ready? Here we go.
Yeah, it's hard with one hand. Try with one hand first. Try with one hand
1,
first.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24,
Deeper,
25,
deeper.
27, 28, 29, 30.
Excellent. Try to be as deep as you can.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Excellent.
Switch students.
Now it doesn't switch to. Don't worry about it.
10 seconds. 5 seconds.
Just stay there. Just stay there. Let's do that the first time.
Now we're going to pause the video to allow you to ask questions and prepare for the next section of the course, Infant BLS.
Okay, so we just covered a lot of stuff. Okay, a lot of stuff. What is the main thing that is different between Johnny and adult? Raise your hand. What's one of the main differences? One-handed compressions, if you need it. If you need 2 hands, go ahead and give 2 hands. What determines you to do 2 hands or 1? Yeah, what's her depth? What are we trying to achieve? About 2 inches. What was it for adult?
At least 2 inches.
At least 2 inches. What is it for child?
About 2 inches.
About 2 inches. Good. And we said that the ratio changed for when?
1 or 2.
Raise your hand.
When it's 2 people.
When you have 2 rescuers. When you have 2 rescuers, you go to 15 to 2. Is everybody clear on that? So when you're by yourself, what is it?
32.
30 to 2. When you have 2 rescuers, it's
15 to 2.
15 to 2. When you have 2 rescuers, how many cycles is approximately 2 minutes?
10.
Who thinks it's 5 cycles? Who thinks it's 10? Who thinks it's 7? Who thinks it's 15? Okay, the 10s have it. Okay, just double it up. 10 cycles is approximately 2 minutes when 2 people are working on Johnny and you're doing 15 to 2. Make sure you count your cycles. Make sure you count your cycles. Again, it's all approximate. What other things changed with Johnny?
You don't call right away.
Yes, thank you. You don't call right away. Okay, if you are by yourself and no one is there to call 911, you stay and you play for 2 minutes. Okay, you stay and you give care for 2 minutes. Now, if they're choking, you're going to give 2 minutes of care. If they're in full cardiac arrest, you're going to give 2 minutes of care. Then you're going to call 911. Now, I have a question about 911 since we're on the subject. How fast do you think it takes for your call to get to my dispatch? Does anybody know? Take a guess. Huh? 2 minutes. That's a pretty good guess. Sometimes 3 minutes. Because if you call, it depends on where you call from. If you call from a cell phone, guess where that call gets diverted to? It goes to San Luis CHP if you call from Lompoc. Okay? It goes to San Luis CHP. You're like, I'm in Lompoc, someone's in cardiac arrest. They're like, okay, hang on. They call Lompoc dispatch. Lompoc dispatch gets the phone. Okay, oh, you have someone in cardiac arrest? Okay, hang on. Let me get you to the county dispatch. So then they send it to our dispatch. Then our dispatch is like, oh, someone's in cardiac arrest? Okay, this is what I want you to do. They're going to EMD the call, meaning they're going to give you instructions on how to help you with CPR. That's 3 people they got to go through. That's 3 transfers. They finally get to our dispatch. My tone finally gets to go off. Fire always beats us to the call here in Lompoc. Do you know why? Huh? Well, there's only 2 fire stations in town. But they get the call first. They get it a minute and a half before we get the call. So they get a minute and a half start before we even get the call. Okay? So that's the type of delay that you could receive out there. But if you call from a landline, that would be a phone that's connected to a wall. Okay? If you call that, pick it up and dial 911, your information is going to automatically go on their screen and it's going to go immediately to the Lompoc dispatch and then immediately to our dispatch. So what I'm trying to say is, if you have a landline, use the landline. But not very many people have landlines anymore. I asked the 6th grade class that. Only 2 people in their house had a landline. The rest of the students didn't know what a landline was. Okay? So it's getting to that, you know, that way, or the way of life nowadays. But I'm like, okay, who has a landline in their house? They're like, what is that? And I'm like, oh, I'm old now. I'm officially old. Okay, now we're moving into infant BLS. Infant. That's dealing with these bad boys. We got 5 minutes, okay? So I'm just going to talk about it briefly, and then we'll do it tomorrow. Okay, so this is Sally. This is baby Sally. Notice, baby Sally is tiny, okay? It's very, very tiny. There's going to be a couple things that are different with Sally, okay? So pay close attention. You're going to need to do it for tomorrow.
Greg, I think we got a problem here. Greg, she's not breathing. Activate emergency response.
Got it.
One, 2, 3, 4,
How scary
5,
would it
6,
be
7,
that you're
8,
going to be pressing
9,
on a
10,
little
11,
baby's
12,
chest?
13, 14, 15, 16, 17, 18, 19, 20, 21,
That's pretty
22,
scary.
23, 24, 25, 26, 27, 28, 29, 30.
Help's on the way. Let's start 15 and 2.
Notice the change in compression
1,
ratio.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 8, 6, 9, 10, 11, 12, 13, 14, 15. Let's switch.
Any emergency can seem scarier when an infant is involved. However, the principles of performing CPR on infants less than a year old are the same as they are for adults and older children, with a few significant differences. To begin, let's take things in the same order as we did for adult CPR. We're going to teach you the skills you will need for 1- and 2-person infant rescue. First, check the victim for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency.
So a question was asked, why do we tap baby's feet? Baby! Well, you don't want to shake baby. Break their neck. No, there's a lot of nerve endings on the baby's foot, so they're going to be very irritated if you tap baby's foot. Okay, they should move. Okay, they should be not okay with that. Okay, flip their feet a little bit. Baby, they're not moving. Baby's going to have a certain look to him. Okay, he or she is going to look sick. Okay, they're going to look blue. They're not going to look right. You're going to be like, something's wrong with baby. You don't even have to be a scientist to know that. You're going to look at him like, something is wrong with baby. I don't know what is wrong with baby, but something is wrong. Okay? Immediately. I sometimes walk into a room and I immediately know baby's not okay. Why? Because baby does not look good. Okay? Everybody understand that? Baby's going to have a certain look. So you're going to know right away. But you're going to be like, baby. You're going to look to see if baby has any chest rise and fall. Baby's not going to have any chest rise and fall. Well, the next thing you're going to check is a brachial pulse. Why the brachial? That'd be this one. Yeah, you're not going to feel anything there. Baby's neck thing is like, oh, like this. You know, like, I don't know. Okay, so you're gonna raise the arm that's closest to you up, and you're gonna put your 2 fingers right on their bicep. Okay, and you're gonna feel a pulse there. I promise you. If you don't feel one, they don't have one. Okay, that is your worst day. That is my worst day. This is something I never ever like to see. Okay, this is my worst day out in the field. Baby is not breathing. Baby is in full cardiac arrest. That is a bad day. Okay, that is a really bad day. So you have to slow down everything. Slow down everything. And it's the hardest thing to teach. Think about it. A baby is not breathing in front of you. What are you going to do? I guarantee you this is going to be your response. Okay. Okay? You're going to freeze for at least a second or two. I promise you. Okay? And it's okay. It's okay to freeze. I tell my intern all the time, it's okay. It's okay. It's a natural response. My poor intern has not seen it all. And that's okay. That's okay. And it's okay for you too. If the first cardiac arrest you have is a baby, I am so sorry. But you're going to be able to do what you're trained to do. Okay? And that is think slow. Baby, no pulse. Start compressions. I will see you tomorrow.